Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and I am joined by a colleague and friend of mine, Stephanie. Stephanie, please introduce yourself.
Cole, thank you so much for having me this afternoon. It's great to be able to get to spend the time with you. Good afternoon, everyone. My name is Stephanie Hilburn. I am a newly dynamic HR professional, and I'm happy to spend the time here with Cole and with all of you today.
Stephanie and I met at Jefferson Health Plans. She was one of the first people to that I had met when I had started at the. We have these kind of lunchtime meetings called the water cooler at Jefferson Health Plans, and we had met each other. And then now she's looking for some new roles in the HR space. So I wanted to bring her on, showcase some of her expertise, and gain some of these insights from her, especially in the healthcare industry where we are struggling with that kind of retention and recruitment, which is what you are looking to, or you already are, but you're looking to specialize in even more, right?
Yes, definitely. Yeah, I'm happy to share my thoughts in that kind of space, right? And we're all in this together. And if any of my insights are helpful and beneficial to anyone, that's let's keep paying it forward.
Of course. And that's what we need right now because it's our health, even ourselves, that are affected in the long run when we can't get a doctor. Nobody's immune to these issues. And so back in 2005, you got your BA in political science and government from LaSalle. I'm a big fan of that university. I've been there a couple of times during their career events. And then you went on to criminal justice and corrections, but then you did this shift to the master's in human resources and management. What was that shift? Why did you change directions?
So in 2019, I was the manager of community engagement within Jefferson Health Plans, known as Health Partners Plans at the time, and working through a different employee relations challenges, being a leader within the organization and with the team. And at the time, I just realized that we were going to be changing as an organization, and I wanted to be a better leader, not just for my team and for myself, but for the organization. And I realized that in order to do that, I needed to enhance my skill set, learn different tactics for leadership, learn different tactics for adult learners, really just increase my skill set to be better, not only for myself and my team, but for the organization as a whole. We were on the precipice of some really big changes that ended up coming down the line. And this was even before the pandemic took place. So, really just trying to recognizing that I was not equipped to be who I needed to become, and decided to go back and get those educational skills to marry nicely with the practical experiences that I was fortunate enough to have while at Jefferson.
So it wasn't necessarily you weren't sitting saying, "Wow, I want to increase my salary, I want a different career, et cetera." You were saying, "We're facing these problems and we don't exactly know how to handle it from a knowledge standpoint." So then you decided to go and get that knowledge so that you would have the backing to handle the issues.
Yes, and that was, as you begin any kind of new path in life, that is absolutely what I went into it with. And then as I continued on with my studies and then was able to receive some really practical opportunities to get the hands-on component at Jefferson Health, really realizing that component of people and investing in your people and taking care of the greatest resource within any organization and in any industry, your people. That really, it was kind of an aha moment for me in realizing that is a passion of mine, and that is really where I want to dedicate a great deal of my time and really put my heart and soul in. So it really was a journey over the past couple of years, and I'm so grateful for Jefferson kind of bringing that opportunity to me and allowing me to see that is what I wanted to do.
And you, over the time, it seems like you became a pretty well-known kind of people leader in the organization, even though you weren't a VP or a SVP, you were still a very well-known people leader. And that's one of the important skills I think, is that leading without having a VP or C suite title, making an impact on people like me, where we were in a very different team. Our teams never really interacted in that close way, but I still was aware of you and everyone on my team was as well. And so I think that's really a very important skill. I want to ask, what were some of the challenges that you faced that sparked you to try to gain these skills? What you were talking about, some difficulties with employees, some changes that were coming along. What were some of these things?
So I think one of the big things for anybody to remember, and this was part of a conversation I had a few weeks ago when I was exploring a new role, the individual that I was talking with said, "Well, this is not a leadership role. Are you okay with that?" And I said, "Yes, because you don't have to have leader in your title to be a leader within any organization, right? You can it's those relationships that you build and the time and the intention that you put in behind that. I think you referenced me starting my degree in 2019. At the end of that year, I had gone out on a maternity leave and I came back at the end of February 2020 and I will never forget this. I was back in the mix of the operation for about 2 weeks before we pivoted from a hybrid workforce to a fully remote workforce at the time, and just really trying to figure out, all right, how do I do this? I had three young children at home with me. I had my workload. We weren't kind of just how do I wear all these different hats at one time? And very early on, it became apparent to me that I had to be intentional. I had to be
Mm.
intentional with my time at work. I had to be intentional with the connections that I was going to make. I had to be intentional when I would disconnect, right? Because I think one of the great advantages of a hybrid or remote workforce is you have that ability to kind of always dial in, but
Yeah.
eh, you almost do yourself a disservice. And I learned that pretty quick in the beginning. It's 8 o'clock at night is what I'm doing. I'm doing a disservice to the multiple hats that I wear. So one of the big challenges in the beginning was becoming intentional and understanding that everyone was going through a lot. Myself, my team, the entire sorry about that. The entire world was going through a lot at that time. So just understanding that when I was going to reach out to somebody or ask for time or schedule a meeting or whatever the case may be, that we're kind of really clear about, okay, this is what we're going to be talking about. This is what we need to get accomplished. This is what we're going to do moving forward. And once that became kind of integrated into my workflow, that really allowed me to kind of get the courage to reach out to people within the organization that I didn't know, to begin to interact with teams that I didn't know before, and just kind of fostering that intentionality with transparency and trying to create a space for myself and for my team where I could say, I don't know what's coming down the line. I don't know what's going to happen. And I understand that I can't give you all the answers you may be looking for. But I'm here and I'm here to listen. And I can't control a lot of what's coming, but I can control the person I'm going to bring to work and how I'm going to treat my team and myself and my colleagues. And I think when you remember that, that really can help you overcome a lot of the people challenges.
You've overcome these challenges. You have now been familiar with working from home with that completely new environment, as well as at the same time as other people having new children and new all kinds of new things going on. Do you, and this is a kind of a curveball question for
Yeah.
you, what do you feel about work from home versus working in office? There's a big push, especially in Center City right now in Philadelphia, to return to the office. The mayor's meeting with officials. What do you feel about that now that you've kind of seen the contrast and you've overcome the challenges with working from home?
I think one of the amazing things that the senior leadership team at Jefferson did with Kat and with Denise, really kind of being intentional about bringing people back into the office. I understand the importance of that face to face and that in person collaboration. And I think that really does hold a lot of value, and that is important, right? Not every role is suited for fully remote all the time, but by the same token, a lot of that can be done in a hybrid space in my assessment. And one of the great things about what Denise Napier and Kepper did with Jefferson was stressing really being intentional about when we're going to bring people into the office. And while I wasn't looking at it from as grand a scale as they were, if I had to bring my team together, okay, we're going to do a couple things in that space that we have. We're going to be together as a group on Tuesday. So we're going to do a deeper dive into some regulatory components that impact the role. We're going to do a refresh on the Medicaid line of business, right? Then we're going to have lunch together as people, not as a team, right? As
Mhm.
people getting to know one another and fostering that relationship and being intentional in that space. And that's it. I think there is value in bringing people back into the office, right? It's not just for the organization, it's for the sake of the city, that center city
Absolutely.
business district, and understanding the economic component of it too. I struggle with just personally the idea that you need to be fully back in. I don't know if that
Right.
necessarily is the answer. And I would offer that creates more engagement problems and doesn't recognize that people bring, yeah, the
Well,
entire
then you're
person.
losing the intentionality. You're just
Exactly.
kind of taking the easy approach to things, right?
Yeah, rigidity replacing common sense. So I really thank, again, I can't thank Denise and Kat enough for just being stressing that intentionality. If we're going to bring you in, we're going to bring you in for a couple things. We're going to make it a really valuable in-person experience. And I think if we
Yeah.
can kind of remember that and be intentional, don't bring people in to sit in a cube on calls all day.
That's one of the issues that I've spoken a lot of with people is it's not just the we were talking about collaboration, and if you're going to be
Yeah.
collaborative, then your office space needs to be collaborative. Your tasks need to be collaborative. Like one of the things that I've talked about is with that intentionality, and I love that word, and I like to dive into that more too, but it's if I'm going to be on meetings at home
Mhm.
5, let's say 4 days of the week, and then one day of the week I have to come to the office and then there's no meetings that day. That's kind of silly. I could have why not fit all those meetings all 4 days of the week into that one day that I'm in the office? And that makes a lot more sense, right? And so I love that that's what we do. I want to further that intentionality and talk about intentionality with hiring and with retainment of our staff. So, especially in the nursing field, with doctors as
Yeah.
well in the medical field, of course, and even lab technologists, some of these fields we don't always think of. There's a huge problem with the hiring process as well as retaining them after we hire them.
Yes.
What, from your perspective, just at a zoomed out thing, what is the issue? What's going on? How can we fix this? It seems like a really big struggle right now.
It is. It absolutely is. Talk to anybody in healthcare and they'll tell you the staffing is just an incredible, it's just an incredible challenge. And I would offer that this was an existing challenge that kind of was exacerbated by the pandemic, very similar to childcare within the US, right? This was a problem before the pandemic, finding affordable, qualified places for your children to go if they're not of school age. I think that finding qualified medical technicians, nurses, physicians assistants, physicians. Finding that before the pandemic was a challenge. And then we placed, just looking at the US, right? We placed an incredible um, demand on these men and women, and however you choose to identify, we place an incredible amount of demand on them for an extended period of time. I think that is absolutely a factor of it as well. I would offer too that kind of the patchwork of public health policy that we had throughout the country,
Mm.
that absolutely exacerbated the challenges as well. And now You kind of had everything associated with COVID and how politicized public health became in the country. And now you still have that, which has not been resolved. You combine that with the challenges of there are so many. Call and try and get in for a annual exam at your primary care doctor right now. Call, because I
Yeah.
guarantee it's probably going to be about 3 months before you
Yep.
can get in. I just know, I personally, my husband does not, he's wonderful, not great with the preventative care. And I'm like, you have to go. You have to go. You've got
Hmm.
to get your blood work done. You've got, and he hemmed and hawed. And yeah, he's waiting 6 months because there are
Right.
so many other emergent cases um, ahead of people. There's that component. And then depending upon where you happen to be practicing, there are so many societal factors that are in place. Philly is going through a lot of, my hometown, we're going through a lot of challenges right now.
Yep.
There's a lot of incidents across the city, and being in the ER space, that's challenging. And
It's really challenging. Yeah.
I don't know if, I think
We
we've
keep
never,
raising salary, right? So
yeah,
why does raising salaries not create retainment? I mean, it creates retainment at to a certain point.
that, I think that's a multi-prong issue, right? I think part of that is going to be the leadership. If the leadership is not empowered within the organization, there's the cliche that people don't leave bad, they don't leave companies, they leave bad bosses. So if you're
Hmm.
not giving your leadership the tools and training that they need to support the frontline associates, you're doing a disservice there too. And I think kind of specifically utilizing the example that you had highlighted, right? You're doubling the physician's salary. But if I'm an ER doctor and I don't have what I need to safely practice medicine in my workspace, yeah, it's great. You doubled my salary, but am I going to spend however long the shift is, 10 hours or whatever the case may be? If I'm going to be spend 10 hours worrying about whether I can safely treat my patients, yes, money compensation is great. And I think you'd be very hard pressed to find someone who would say, no, don't pay me more. But at a certain point, what is that compensation going to do if you can't do your job safely?
You mentioned giving them the tools to do their jobs, but how do you even improve the safety in these workplaces? What are some ways that we can make staff feel safer and that we can improve the quality of their lives without just giving them a bigger check?
I think if you're in an ER space and you're interacting with someone who maybe has a mental challenge or any manner of mental health issue, right? There needs to be, and it sounds so simple to say it, more access to mental health professionals
Mm.
and accessibility in crisis support and access to medication therapies and behavioral health therapies. And we need to increase the access to those things, and not always in the conventional way, right? Like similar to the workplace, we need to be intentional around it. If you're a psychiatrist and you can treat someone well virtually, okay, then kind of treat the patients that you can in that space, and then prioritize keeping the in-person ability open for individuals who maybe have to be seen in that kind
Mm.
of space, right? But even doing that, it, it's going to take time. During the height of the pandemic, I was supporting a family member who was looking for mental health treatment, and it took a year. And I know how the provider space, I have an idea how that works. Can you imagine what it's like for someone who doesn't know? And all they're given
Right.
is a sheet of practices to call. And what if they call all 10 on that sheet and then none of them can treat them or that family member? I think increasing access to and funding these things like 988 and virtual therapy sessions and increasing access to medication, all of these things benefit people and hopefully eliminate the number of these cases that are getting to the ER, right? One of the wonderful things that Jefferson Health does is kind of educating their members and even their team members, right, around proper utilization of the ER. I think we also need to,
Mhm.
that needs to be a component too. The ER is not your primary care doctor. The ER is exactly that.
Right.
It's for a medical emergency to get you stabilized enough to get you into that treatment. And unfortunately, because of lack of providers, lack of access to providers, transportation, right? The ER is the primary physical and mental health treatment for a lot of people. So I think creating a safer space in the hospital, absolutely, we have to do that. But it's in vain if we're not looking at, why are we waiting until an individual is at the breaking point before we treat them?
Yeah.
And
So we
it's
have to increase access, but increase the right kinds of access instead of just increasing ER access or increasing in person health, behavioral health. We need to have all these different options for people, or else they're going to keep going to the ER.
Yeah, and one of the practices that I personally worked with, and I know Jefferson worked with as well, it provided education to their patients. Hey, we're the first call. Like,
Hmm.
call us if we tell you need to come in, or we tell you you need to go to urgent care. Like, just kind of explaining all the different avenues that are in place now for treatment to people is absolutely going to help, I think, reduce the number of issues that actually hit the ER, right? So that's going to keep people safe too. And it's better for the health plan too, because you're going to lower your utilization rates of ER visits, which makes more sense for the health plan as well. But these are,
Mm.
I think sometimes when we kind of get into these spaces of, it's not an easy fix. It's not an easy fix, and all the parts of the health system play a role, and sometimes we kinda need to challenge what we've always done or the way we've always looked to fix an issue. Throwing money at things and throwing people at things is not always the best way to go about solving
Well,
problems.
and I want to ask about that last point, throwing people at
Yeah,
things. We need more nurses, but at the same
yes,
time, with hiring, I worry about maybe harm that comes from just hiring nurses without actually having a intention set up for them. What
yeah,
job are they going to do? Why
mhm.
are they going to do it? What department? Instead, it's almost as if we're just hiring droves of people and just kind of throwing them in every area instead of actually having a real specific purpose. Do you see that as a problem? And what effects does that have on an employee when they feel like they're just being hired in kind of a shotgun approach?
I think with that shotgun approach, right? Think about any kind of interaction that you've had with the healthcare system. Arguably, most of the time you've probably spent talking to a nurse or a
Hmm.
nursing assistant, right? That is not by any stretch of the imagination to kind of diminish the work of the physicians, but the nurses really are the frontline associates of the healthcare industry. So I think if you just keep bringing on people and you don't invest in the ones that you have and you don't allow them to become the subject matter experts and increase their knowledge and allow them to form that relationship with the patient, you're going to lose that knowledge. And it takes so much time to build up that knowledge base. I had a personal experience delivering kind of, I have 3 daughters, delivering all 3 of my daughters, and the nurses that were on the maternity floor were all very tenured nurses. They had been there for 10, 15, 20 years, and that was very reassuring as a first-time mom, and just kinda going through the different challenges with each delivery, because I interacted with the physicians for maybe 5, 10 minutes while they were doing their rounds, but the nurses were there when we've seen this before. This is okay. All right. This maybe isn't great. Let's try a few things first, right?
Hmm.
They are, they're really the ones interacting with your patients. And if you don't allow them the the time and the ability to develop those skills and to begin to anticipate things that are going to happen or that symptoms that patients are going to experience, I fear you run the risk of missing things, and then you have
Mm,
negative patient experiences. You have negative experience for the nurses and for the physicians, right? It is an incredibly noble calling to go into to healthcare and to put yourself at risk treating people who are going through horrible diseases and different conditions. And I think if we don't take the time to invest in those people, we're going this staffing shortage that we're seeing now, it's only going to get worse.
mm.
It's only going to get worse, right? And compensation doesn't solve everything. If you go into work and you don't know who's going to be your nursing supervisor that night, what why are you going to keep going into that space? It doesn't make
Well,
sense.
well, thank you so much for your comments and this excellent, I guess, advice for the industry as a whole. It's very much appreciated. I appreciate you sharing your lunch hour with us today. Best of luck in your new
Thank
kind
you,
of career
Cole.
path there. And hopefully we can have you on again in the future.
I would love that. Thank you so much for your time and for the opportunity to kind of share my thoughts. I hope that helps someone out there, right? And we can pay it forward together. So thank you for that.